You need to unmute, Diane.
Okay.
All right.
All right. Roll call.
We did that.
Already did
We're on
that.
approving the agenda.
Okay. Approve the agenda. Okay. All those in favor of approving?
I move to approve the agenda for January 20th, 2021.
Okay, so we're on
Second.
comment. We're on comments.
No, we need to vote on approving the agenda. We hadn't made the motion
okay.
yet.
Okay, could I have a motion that we approve tonight's agenda?
I so move.
I
Okay.
second.
Okay, any discussion?
No.
Okay, it's been approved and seconded. All those in favor say aye.
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 Opposed? None. Okay, comments. Personnel Commission comments. Andy?
I just hope that everyone had a good holiday season, a nice Christmas and a nice New Year's. And now it's back to work.
Okay. Pat?
Yeah, well, just Happy New Year, everybody. Just hope we can keep this all going together. New administration in today, so hopefully we can get more vaccines rolled out and get everybody vaccinated so we can kids can all get back to school.
I agree. Just wishing everybody a Happy New Year. Stay well, wear your masks, and hopefully we can be through this before too long. Executive Director comments. Mr. Yanis?
I just want to welcome everyone back, wish them a happy new year. Just to know, just to keep everyone still on alert. As you're aware, we're still on in the purple tier. We have been experiencing more, we have been notified of more instances of employees impacted by COVID-19. Fortunately, it's been not from work for the most part. So, still practicing caution. We have had some updates from the county. Hopefully we're seeing a flattening. Again, we're always monitoring and working. Our goals are just as was stated. We want to get students back in the school back at the in-person learning. And hopefully if we all remain vigilant, we can lower the rates, put us back into a safer environment so that we can do what we're supposed to do, and that's provide the social emotional well-being for our students as a district. And I think other than that, I think I just mentioned, we have been getting more of our employees. We've become more aware of cases. And then I think the other one too, just to keep the commissioners aware, the FFCRA, the Families First Corona Aid Relief Act, it did expire December 31st. And that did provide the 80 hours of relief for employees for quarantine purposes, and it also allowed for employees who needed to use childcare for students who were displaced because they weren't able to attend school, up to 12 weeks pay, at up to 12 weeks at 2/3 pay. That did expire December 31st. So we don't know, as you mentioned, there's a new administration, if additional funds are going to go out, but there are some kind of more of the immediate impacts that we see now, especially given now that the rules have kind of changed, and that is that if you had a potential exposure, that you are subject to a 14-day quarantine now, versus a negative test being able to bring you back. So they're being a little more stringent as to what the requirements are. That concludes my comments.
Thank you. General public comments?
Okay, it looks like we don't have any general public. It's just Debbie and Jackie. So I think we can move on unless they have a public comment.
Okay.
Doesn't look like it.
Okay, I can't move the agenda, so we're down to what?
My computer's just a little slow because I'm on it here. So we're on the consent agenda.
Okay.
I
So-
move to approve the consent agenda.
Okay.
I second.
Okay. Any discussion?
The recruitment status report, I just had a quick question on that. There was something on there, there were 2 items. I'm wondering if this has to do with the restructure of M&O, but it said something about pending board on the on-hold
Oh, I see
requisition.
it.
Pending board resolution for elimination. Does that have to do with the M&O restructuring?
Yes, it actually it does. The facilities project manager. So I think that was part of the initial restructuring that we had. That was a position that when we did the restructuring that occurred with the previous director, and that's when they had the assistant construction manager, a project facilities man, all of those positions, it was deemed that those would not be necessary. We never were able to hire for those. So it kind of can almost just cancel out now because it's become a position that based on the board action, I think it was on May 6th or something, with the would have been abolished by now. So we'll have to go through and clean that up.
So they have already been eliminated.
Yeah,
I
we
thought
never
they had.
hired for that position, but
Yeah.
that's when we had the layoff for the assistant construction manager, and then that was the facilities project man. There was all kinds of positions that were created to support the bond structure.
Okay, all right, that was my only question.
Okay, since there's no more discussion, could all those in favor of accepting the consent agenda say aye?
Aye.
Opposed? None. It's been approved. Are we to information?
Yes, we're on the classified staffing report.
Okay. Go ahead, please.
This is just the basic classified staffing report that was approved by the Board of Education on January 13th, 2021. Again, we're not seeing too many new hires, but we are, of course, seeing a lot of leaves of absences, and it just continues to look the same.
It seems like there's a lot of people out on medical.
Yes. And we're not able to put release any information other than medical. So
Sure.
if
No, I
it's
understand.
FFCRA or anything related, we don't put that.
Sure, no.
Yeah.
Okay.
Okay. The next
Well,
one.
this is driving me crazy reading this on my phone. First reading of workplace health and safety manager job description.
So just to give a little background on this, with the the FFCRA funds that I mentioned earlier were one component. There are additional funds and that were provided by the state, and we're also hearing of more additional funds by the federal government. And the whole idea behind this is that there definitely are requirements for us to begin to go back to in-person learning opportunities for our students and also for our staff, which are inclusive of very strict reporting requirements for OSHA and Cal OSHA, 2 separate organizations, but very stringent nonetheless, and it puts the burden on the employer to ensure safety, and that we have protocols in place and tracking system in place. It's a very intensive process. On top of that, we also are required to do testing, employee testing for COVID-19. And the new one coming down the pike is that when students come back, we're supposed to have a plan in place to also test students. So this is going to be a Herculean task that, given the existing resources that we have, we knew we wouldn't be able to have the right personnel and the right not to be gender specific, but manpower to be able to put this together so that, again, we can keep with compliance. We can address the need for testing, a testing program for our employees that is going to be mandatory, and also just to ensure that we're meeting all of the reporting compliance issues that surface with it. So you can read it, and if you, I hope you had the opportunity to review your agenda beforehand, the various bullet points in terms of the implementing, coordinating, monitoring of student and staff, health and safety training, the tracking, reconciling, monitoring leaves. So it's this multifaceted type of position that's really set up to support a lot of areas of the school district. And again, I think going back to even Diane, your comment on the employee, even that individual looking at our leaves, ensuring that we have a consistent interactive process. Right now, through the district, there are 3 of us that do medical interactives. And with the heightened concern with regards to ensuring that we are all being uniform and not exposing the district to potential discriminatory claims, this is also an attempt to make sure that we bring this under one individual or at least one department, so that it's the same filtering lens that's being used for our medical interactive process. So this is a big piece. I think it's a necessary piece. If you do any research, you'll find that surrounding districts are doing the same type of job. So this is a burgeoning market right now, and one that we worked on drafting, putting together job descriptions, looking at kind of what the needs were based on the various Senate bills, Assembly bills, state and federal requirements, and regulatory agencies.
Yeah, I read through this, and it's huge, all the reporting on this. We used to have a health and wellness coordinator, didn't we? But it certainly wasn't anything close to this. Of course, we didn't have COVID then either.
The good days, huh?
Yeah.
Yeah. And the other thing is that it's really has been, and there's been several, opinions that are coming out that it's really the cumbersome requirements of Cal OSHA. And I totally get it when we talk about employee safety, but it's just really ensuring that we are doing our due diligence and that we're able to dedicate the resources in the form of an individual or potentially multiple individuals to carry out this type of work. Because again, as I stated before, this is going to be a Herculean task. I mean, this is not only going to be the implementation of a wellness program, but it's also going to be the coordinating, the creation. It's going to be all of those aspects.
Yeah.
Is there a reason why it says it's only until 2023?
So the reason for the requirements are that OSHA is essentially based on their last requirement update. I think it was back in November when we started working on this job description, essentially said that employers had to track this information until 2023. So it's not necessarily to say that this position would expire in 2023. It's more so to say that currently that requirement by OSHA for us to maintain employee records, tracking all of those components that they would want, the compliance, they'll be monitoring that through 2023 at this point.
Will this be just for school employees, or will it be all district employees?
With regards to what, Geraldine?
Well, the testing and monitoring.
Oh, it's going to be all employees. So I'll give you an example, or I'll give you kind of like a very local. Kim, Assistant Superintendent Watts, Assistant Superintendent of Business, Guard, and I visited the county, and the county has a comprehensive testing program in place. What we have done as a school district is that we have piggybacked on the county's initial contract with Curative. And it's a testing outfit, we did a piggyback contract so that they will be our testers. So they'll be the ones who process our testing. And right now at the county, they test their employees twice a month. It's all mandatory. They have to sign up. They have to enter their insurance information. If they don't have insurance, there's a pot of funds that we're still able to use, from federal funds so that we pay for testing. But the county, Alameda County Office of Education currently does the testing. And so all the districts will be following suit. So I think Castro Valley is starting this process. We're all getting geared up to do it, and it will be all of our employees.
So including us?
I'm not sure because you're not considered employees. You do hold positions in terms of from an oversight board, but we can definitely check. But we can definitely, I don't, if the question is whether we can include our commissioners in that process, I definitely think that we could.
And board
And
members.
board members
And board
also.
members, yeah, I definitely, I don't see that as being a problem at all. And I think it makes sense, especially if we move back to an in-person kind of approach to where we're not just providing in-person learning opportunities for students like it used to be. I don't want to say back in the olden days, because it was only, 10 months ago.
A year ago.
But yeah, I think that makes total sense with regards to that. So I can see it. Probably the question would be, would it be inclusive of our commissioners and our board of trustees? I think that makes total sense. Yes.
Okay, just curious. Okay.
Can you go back to the attachment, Christy? I just had a question under the requirements for this job. I mean, I know a lot of it is just bookkeeping and stuff, but is there any thought of having any medical background at all to this, or?
Not necessarily, and I'll tell you why. Absent it being a medical, because everyone, we're all are internet diagnosers nowadays with the advent of the internet and information being so easy to get to. We do. With that being said, part of our efforts at coming up with a plan, coming up with a return to school plan and everything does include our school nurses. So there are these folks that do have, because they would be considered the medical professionals because based on their licensure,
Right.
not just their nursing credential, but also their actual nursing license. So I think we get, but so obviously we work in tandem with them, and this person would do the same. I think it would be a plus, but I will just, in all honesty, I think it could potentially limit us if with that sort of requirement.
So this person would not be over the nurses; they would just be working with the nurses then.
Correct. So what this person would do is they would oversee and they would implement and they would work with the various managers. So kind of case in point, as I stated, with the testing that happens at the county, the nice thing about the county is it's one building. There's 250 employees. They just have to run testing there twice a month and it happens. We have the task of having 31 school sites in addition to the district office, FMOT yard, nutrition, so we have the SIAC campus, we have the hub. So it would be really coordinating with kind of what needs to happen, what that looks like, what each game plan looks like for each site for whenever we have the testing dates. But they would all work in concert. There should be this flow of information to where you do have this, I don't want to call it a task force as if that's the actual title. But we have we have the nurses involved. We have Dr. Michelle Perez involved, who is our compliance officer. So there's various elements, and this would just be a person who would really spearhead the implementation and the carrying out of a lot of these tasks.
With the test, go ahead, Pat.
No, I think it was
That
Andy.
was Andy.
Oh, Andy, I'm sorry. Go ahead.
It's okay. I was just curious because the explanation of this particular item, is pretty much all about COVID-19 and doing, yet the job description is extremely generic. It doesn't mention anything about COVID or anything like that. And when putting out a bid for this, are you going to actually talk about COVID and some of the duties, so when people apply, they know what they're applying for? Because this particular job description is extremely generic. It doesn't even mention anything about medical. It just talks about, reports and stuff like that. So I was just wondering, I was curious.
And I can appreciate that. And I think, Andy, I think that really the work that we do when we work in coordination with the school district, when they create the jobs is that COVID-19 is kind of the driver However, the principles of COVID-19 are applicable to any other potential outbreak that could occur. So it's really, you want to keep the job description focused in the sense of these are the essential duties that are transferable given any sort of outbreak or situation or wellness circumstance that a district might have. And we can definitely make sure that we put something out there to say, you know, due to COVID, because a lot of the requirements that OSHA has right now, you know, it's a tracking component. It is, you know, having a safety plan. It is having a sanitation plan. It is, you know, absent COVID, we're still going to need those kinds of things, but I can definitely understand
Well,
what you're.
it just appeared so generic. You could be talking about anything. So I just thought that when going out to bid or whatever for the job, that you might want to mention that at this particular point, because of the change in regulation, a lot of the job will be tracking of COVID and what you say at the beginning of this item. I was just, not to change this because you don't want to make it so, I mean, so not objective that, you know, it's just for COVID, but you don't want to make it so generic that people will say, well, geez, I didn't know that that's what I was going to do.
Yeah, with our job descriptions also, Andy, we try to make them pretty generic just so that it covers more area. Just like, you know, in my job description, it wouldn't say, you know, using a specific, like our board or our agendas are on Simbly. It wouldn't say, you know, use Simbly, or it wouldn't say use NeoGov, which are brand names of our software. It says use various related softwares. So this would be the same thing. COVID would be kind of a brand, which we wouldn't want to identify in a job description.
But the other thing I'm saying is that, don't you think the person would like to know that that would be one of the main functions at this point because of the change in regulation from OSHA? That's all I'm
Is
saying.
there something that could go out, like when you post it before the job
It doesn't have to
description, like a summary saying that, you know, this would be dealing with a lot of the COVID-19
COVID,
testing.
yeah.
But,
I mean,
but,
in addition,
but it
like
could
in
change.
addition.
Yeah.
I don't know.
I mean, I think we can definitely visit that when we fly it, when we put it out. I think it goes both ways, and I'll just be really honest with you. You know, I've been in instances where someone will say, "Hey, this wasn't it wasn't advertised this way. I didn't know I was going to be dealing with this," and it's like, no, that falls under that's part of the essential duties. So it can go both ways, but we can definitely look at it. I mean, I appreciate kind of that feedback on it. You know, again, the job description is written. That's kind of the board
right.
piece. But we can definitely, we're the ones who will go out and we will recruit for it. And we can just ensure that folks understand that this is in light of COVID. I just wouldn't want, if COVID goes away all of a sudden and we get to the place to where we're no longer in that environment and COVID isn't the driver, I wouldn't want someone to turn around and say, well, you know, now it's a new thing, and that wasn't in the job description, that wasn't in the announcement. COVID is gone, so if it's not COVID related, I'm not supposed to do that, because believe me, we have people who have done those kinds of things before. So
Right.
but we'll definitely look at ensuring that people understand that it's based on a current pandemic situation and the shifting changes from the Alameda County and you know, the public health departments.
Okay, I'm not saying you should change the job description. I was just saying that in light of the fact that that seems to be the primary focus of having this particular job now, that it would be nice to just kind of alert them that that might be a big deal. This would be ancillary to your job description. That's all.
Yeah, and that makes sense. But I also do want to point out that another big piece of the job is the medical interactive process.
Okay.
Because again, looking at the health and wellness and safety for the district, and that is, regardless of COVID, that's a huge piece for us that right now is split between, again, three individuals. I do all of the classified. Rosemary Rivas is our risk coordinator. She does all of the workers' comp individuals. I do all of the non-workers comp classified individuals, and Director Aurora Sweet does all of the certificated. So again, a huge piece of that is ensuring that we're looking at that through the same filter. So, but I hear what you're saying, and I think we can definitely figure something out in the recruitment
Yeah, I mean-
process so that when we do announce it, folks understand that, you know, it's based on kind of what the needs of the pandemic are calling for, and the regulations that are coming from both the local, state, and federal level and agency levels. But we can definitely look at that.
Just real quick, that second paragraph right there, history and background, where it talks about confidently manage the district's health and safety requirements and follow HIPAA laws and stuff. Is that in the job description, or? Because that's something that might be in there, because that's something that it doesn't matter if it's COVID-19 or whatever. Wouldn't that be something that would be part of the job?
Well,
Right.
that is, can you scroll, can you go back up to, there you go, Christy. So what they would do is if you look at the basic function, I think those elements are there where it says oversee and monitor implementation of employer required health and safety programs and applicable insurance reimbursement processing. What I think that sentence really says is that we need to ensure that we have, that we don't, part of the idea of creating a new job description and a new classification is the realization that we can't just assign this to Christy or assign this to current staff right now. We need to ensure that from a liability perspective that we have someone who is solely responsible for these tasks. But you know, again, I think and then just to clarify, any adjustments that we make to the basic functions or the representative duties, that would fall on the district side for doing that, because for the Personnel Commission, we focus on the KSAs and the MQs, the knowledge, skills, and the abilities, and the minimum qualifications. The other components have already been identified by the Assistant Superintendent of HR, Watts, as to like, these are what the functions are going to look like.
Okay.
So yeah, but I hear what you're saying, you know, in terms of, obviously there's a job description, and then there's like, what does that look like in action? It's the personification of the words, both programmatically and also through the actions that are carried out.
Okay.
Just one suggestion, going back to the testing. If there's any possibility that we could work with Cal State Nursing Program and get some help from the nursing students to help administer the tests.
Yeah, Cal State and Chabot, both
Yeah.
nursing students.
Both of them, that could move things along a lot faster.
And I think we definitely could. And again, that's where someone like this would potentially coordinate with additional services, because even at the county, from when I went and I visited, they did have some of their internal employees. They actually happen to be HR folks who would wear the white labs coats. And then they were the ones that were monitoring the testing. The testing that is done through Curative is all it's all done by the individual. So it's basically, they do the swab around their mouth, and then they put it in, you know, they have these videos, they have these stands, and it just trains them on how to do it. So it's a very hands-off. It's not I don't know if you have, I don't know if you've, raise your hand. If you've had the actual COVID testing where they swab your mouth and then they tickle your brain. They wouldn't be doing that invasive. It's more of the saliva testing that they do with regards to that. But we definitely can, I think that's a consideration that we can definitely look into.
Okay, just suggestion.
Yep.
Okay, so this item was informational only. It'll come back for second reading.
Yes. And I think that with that, we want to begin, and I just want to make sure, like, we want to start the process. I think that we have historically always done 2 readings, but there have been instances where we're like, based on a need, we would like to start the recruitment process. So you know, and then we can put draft, you know, absent any major changes. But I just want to, I hope that that is okay with the commission, that we start that process.
Yeah, a lot of,
Um,
my whole thing was not to change the work, the job description, but just to provide a little bit more information on an ancillary basis to anyone.
Yeah.
That was,
Yeah,
Yeah, and I think this is, and Andy, I appreciate that, because I think that this is, if you really think about this, this is because of COVID-19, and it has created this need. This does lend itself to being almost one of these like newly specialized positions. I think that said, as Diane said, the district previously had a health and safety coordinator, and it might have just kind of lived in a different space. But I do think that, going back to my initial, that all the surrounding districts, I mean, everyone is like, I'm on the HR consortium kind of, the emails, everyone's like, okay, what are you doing? You know, like, everyone's creating these job descriptions. So I agree with you. It is incumbent upon us to present it in such a way, because we're going to be competing with individuals. So just how do we get it out there so that it's very clear as to, like, these are the pieces and components with it. So I think point well taken. You know.
okay.
I think it should get out there and start getting somebody in this right away, because I think this is a job a position that we need.
So
Yes,
do we
thank
need to
you.
do anything? Do we need to like approve it?
No,
preliminary?
it wasn't posted. I think if anything, you know, we're having a discussion. It was really for information only, so it's not an actionable item. I'm more so in terms of just informing the commission to say, hey, this is what I would like to do, and I can move ahead. The job description has already been approved, unless barring any major considerations. We've done this before for positions to where we've started the process. And then we just kind of put, you know, it's still pending final personnel commission approval, and then we can get. But I'm of the light, just because we've been seeing an increase in the reporting of cases, our employees, and just the managing and the tracking. That right now we're taking a splintered approach, and it's kind of, you know, it has a potential based on the reporting requirements to OSHA to put the district in a place where it's like, it's not really the best record keeping. So we just want to move to starting the recruitment process.
It could cost a lot of money too.
Yeah, I think under the circumstances, with as huge as COVID is with everybody, I would say go ahead. And then we can vote on it next time, but go ahead and post.
Perfect. Okay.
Is that okay with everybody?
Yeah.
Yeah.
Okay. All right, we'll go to action items, ratification of eligibility lists.
I move to approve the eligibility list for facilities maintenance manager.
Okay, is there a second?
I second.
Any discussion?
No.
Okay. It's been moved and seconded. All those in favor of accepting the ratification of the eligibility list, say aye.
Aye.
Aye. Opposed? Okay. Going to approve the second reading of Personnel Commission Annual Report.
Okay, I sent this over to everyone, and I did get some feedback on, there was a typo here. This should be 2020, not 2019. So I will change that. But this is pretty much the same that we talked about last meeting, except this page here, we've updated this page with the new information. I don't think this was included in the last one. So if you have any questions, it's pretty self-explanatory. There's the numbers are, you know, they were a little down, the regular and the substitute, but that's because of COVID. Is there any questions?
Oh, looks good.
No, I just had a question on that date, so
Sure.
if you can get that changed.
I will.
Okay, can I have a motion that we accept the, Personnel Commission Annual Report as submitted with
Yeah,
the correction?
Okay, I move to approve the 2019-2020 Personnel Commission Annual Report as presented in the packet.
Okay, have a second?
Second.
Okay, it's been approved, moved and seconded. All those in favor say aye.
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 Just one last, is there a date when it's to go to the board?
Yes. So here's the dates here, the upcoming Board of Education meeting dates. We have February 10th, the 24th, March 10th, and March 24th. And if you guys want to pick your first and second option, then we can have Fernando discuss with Dr. Wayne on which date would be the best.
I'd say probably sooner rather than later.
I agree. March 24th is out for me. But the others, I'm open to any of those first three.
I have no preference.
Okay.
Okay, so Fernando, if you want to talk with Matt and see what works best and let us know.
Sure, I'll get the dates and then we'll look at what the agendas look like, because I know that they've been shifting some of their agendas to go towards a work session format. But definitely. So Chrissy, just let me know the dates and then I can follow up with Matt.
Will
Okay,
do.
thank you.
Okay.
Thanks.
So next is the public comment on closed session, but we don't have anybody here. It's just Debbie and Jackie still. Hi, ladies.
Hi, ladies.
We still like you.
We
Um,
miss
seeing
being a
you,
great
though.
audience.
Yeah.
We miss seeing you guys though in person.
Yeah.
Yes. And then there really is nothing on the closed session that we would need to reconvene to report. So if someone wants to adjourn the meeting, we can do that. The next meeting is, that's actually something else I wanted to talk about, because the next meeting is scheduled for February 17th, but that is President's Week. So there's actually no school. So it's like a early spring break. So I don't know if we want to change that, or
They're out all week. Wow.
I mean, we're
Week.
working, we only have Monday and Friday off, but I mean, those are work days for us, but I was just going to throw it out there to see if we want to.
So the schools are out all week. Wow.
Yeah.
Wow.
So what would you suggest?
Well, the Wednesday before and the Wednesday after are both board meeting dates. So we would have to look at, like a different day besides Wednesday, but, the second week or the last week of February.
What about the following Monday? What date's that?
The 22nd.
Yeah, is that a holiday of some sort too, or no?
Not that I'm aware. Some people, like if you have two different President's Days, some people will do it the 2 Mondays. So maybe we do Tuesday, the 23rd.
Okay.
Okay.
Looks okay on your calendar, Fernando. You okay with that one?
Sure.
Okay.
I don't think I'm washing my hair that day.
No headache scheduled or anything? Okay.
No,
Okay, so we're
no,
doing
I hadn't heard of that one. Yeah, no headaches
23rd.
scheduled.
I use that all the time.
Okay. So February
Okay.
23rd, then
5:30.
5:30.
All right.
Okay.
Okay. Thank you. Okay. It is 6:11. I will close the meeting and we'll go into closed session.
Great.
Doke.
See you later.
See
Bye,
you there.
Debbie. Bye,
Thank
Hi,
Jack.
you.
Christy.
Bye. I'll see you in
Bye.
closed session in a
Good
second.
night, everyone. I'll see you there.
Okay.